This is the second postoperative visit, and now that their drains are out and swelling should start to be coming down now, we should start seeing some shapes and you know, how the overall area is healing, how the incision looks, how the drain site looks. They're still wearing the compression garment that is going to be worn for a total of at least 6 weeks at least. So also the patients are going to get a real impact now of how they're going to start to look. So it's a good and exciting time, I think, for them and me. Sometimes we'll change their garments at this time because we want it tighter and a more comfortable garment, and that's something we'll probably do, I think, as well. So this is post-op appointment 2, and hopefully they look good.
Actually, it's been very good the last couple of days. Since the last time I was here, which was last Wednesday. It's been very an enlightening experience of just watching things as they settle in, and watching the difference in my body and the contouring, and I was taking shape, and yeah, I'm very impressed. It's very, very flat, much flatter than it was, and so it's a dramatic change. My expectation was this far exceeds my expectation.
Hey, Jerome.
Hey, Doc. Good to see you.
How's it going, man?
I'm doing very well. Thank you so very much. Doing very well.
I like this homemade foam you got going there, man.
Isn't that something?
That's good. Why don't you take everything
Okay,
off?
say it out.
How you feel?
I feel good. I feel really good. I feel
The pain and stuff is reasonable?
Every now and then, because I'm waiting off of the Darvocet, I'm trying to.
Yeah, get off that. Tylenol is good. You're looking good there, man.
I know. I'm impressed.
Yeah. Yeah, man.
I'm impressed.
It looks really good, actually.
I'm impressed.
That skin's coming down.
Yeah.
You got some fluid there, though. Have you taken off the vest at any time?
Yes, sir.
So this is an example of fluid, as you see here. So you can see there's a wave in there. So what we're going to do is stick a needle in there and pull out some fluid. Wear that garment, man, at all times.
Okay.
You haven't been cheating, have you?
No, actually.
You can tell the doctor now.
Well, actually, you know what? It got a little uncomfortable one night, and I just, I kind of took it off for maybe about an hour or two. And yeah.
And when did that fluid kind of come up?
Probably.
Any idea?
I can't really say. I noticed it 2 days ago.
Okay. You can tell the doctor the truth.
Absolutely.
I'm here to help you.
Look, I don't want to tell you any lie whatsoever. Yeah. No, not at all.
God knows.
Absolutely.
You can't hide from Him.
That's right. That's right.
I think we're going to get you to a different garment, too.
That'd be a wonderful thing. That one is so noticeable.
It's noticeable, and it's just a lot more uncomfortable.
Yeah.
The fluid's not a problem. It's not going to be a long-term problem at all. The only thing is sometimes it will take a few times of tapping this fluid out to get it to go away completely. Relax now. Yeah, we got a little bit more swelling here in the area, and this has to fill out from that fluid being there.
Actually, I'm just so sleeping on one side. You can't do that, and you kind of.
You can if you want.
Really?
If it
I was
doesn't hurt
concerned
you.
about that. I was thinking that maybe since I tried to sleep on my side one night, and it just was a little uncomfortable. I was thinking that's maybe where that fluid came from, and so that's what I was thinking.
Oh, you
that night
sleeping on that side?
Yeah,
down?
that's the side.
That side down.
Yeah. So.
Sometimes if you're sleeping on one side after surgery, the fluid will tend to pool on that side. Okay. But this is a well-known complication after any kind of surgery that a drain's used, where the fluid accumulates after it's pulled out. Okay. And so that side is going to be behind a little bit than this one.
Okay,
It'd be
okay.
behind the healing curve a little bit,
Okay.
but not anything substantial.
Okay. As I was saying earlier, I'm just totally impressed with the overall result. I was more than well, it surpasses my expectations low. You know,
Well,
so,
that's nice to hear.
and so yeah.
Well, hopefully this springtime you'll be out there.
Yeah, I'll be out there. I will be. Not hopefully.
I'll be right back in, okay?
Alrighty. So this vest, I know, this will be nice. So this one needs to be worn for the next 5 weeks.
Okay.
Day and night. You can have it off for laundering, but ideally wear the other one when this one's being laundered.
Okay.
Just let's get your steri strips on. And they can be applied just right over the top.
Okay.
When you take it off,
Yeah.
okay, it should be a little bit snug there. Go ahead and take the bottom. See if you can get that zipper. Yeah, sometimes we'll have to pull from. You need to give it a little pulling around the edges. I know they're tight.
Sure are. This is like extra.
It's like a test, isn't it?
Sure is. Like that. I can't get that. It's not good.
Okay, there you go. Okay, now the other part that he likes about this over the other one is it does go up high into the armpit.
Okay.
He wants it like that.
Okay,
So what you don't want to do is you don't want to pull it down to get it so that this is coming down
Okay,
too far.
good.
He wants it up there.
Okay.
But what he'll come in to check is to make sure that this isn't too loose, because it should be as snug, you know, as you're feeling it down here.
Yeah,
It
it's-
should be that way all up in here.
Okay. Okay.
So sit tight for a moment. I'm going to tell him you have it on.
Will do. Okay.
But it fits you pretty good, man. I think you're good. So, you know, also pull this down so it doesn't give you wrinkles here.
Sure.
Okay. All right, man.
Okay.
We'll see you then.
Thank you,
You
Doc.
look good.
Thank you so
All
much.
right, you're coming along.
All right.
And no exercise.
Yeah.
So remember, don't overdo it with your arms. That's what often causes the swelling.
Oh,
You know, the
okay.
fluid accumulation is
Okay.
too much, too soon. So even though you may feel better,
Mhm.
don't start doing too much.
Okay.
Because it's a solid 4 to 6 weeks of no exercise.
Okay.
Patients look great. No bleeding whatsoever, which is what I really like to see, because that's what I see most often with these kind of aggressive treatments. But everyone looked excellent. The shape looked great. All the incisions were healing well. Jerome, I was concerned about at first because of the superior incision, but you know, he's healing beautifully. So again, I'm very optimistic. Everything's swollen. We have to wait for that to come down. You know, I don't want any of the men to be too optimistic and start working out or doing anything crazy too soon. But everything it really looks good. I'm very pleased.